Hello, in this video, I'm going to talk about what the glycemic index is, how to interpret it, and why we might want to follow a low GI diet. So the glycemic index is a simple system that rates carbohydrate-rich foods based on how much that food affects your blood glucose or your blood sugar. So the glycemic index is on a scale from 0 to 100, meaning 0, the food has no effect at all on your blood glucose, and 100 is based on the effect that pure glucose has when you consume it. So if you consume pure glucose, the effect that it has on your blood is how we would rate 100 on this scale. Okay, so any food we can rate from 0 to 100, depending on how much it affects blood glucose. Now, importantly, glycemic index has nothing to do with the nutritional value of a food. So it has nothing to do with how healthy it is or how many vitamins or minerals it has or protein or anything else. So it's not about nutritional value. It is simply about how much effect that food will have on your blood glucose. It also doesn't take into consideration how much you're eating. So like something that like watermelon that has a lot of sugar, it has a high glycemic index, meaning that has a big effect on your blood sugar. But if you eat a normal amount of it, it actually doesn't have that much effect on your blood sugar. So glycemic index taken by itself can sometimes be a little bit misleading. And that's where glycemic load is important to understand. And my next video will be about glycemic load. So how do we interpret glycemic index? So again, it's a scale from 0 to 100, 100 meaning it has the greatest effect and 0 meaning no effect at all. So a food is considered to be high glycemic index if it is at a 70 or greater. So those are foods that we digest and break down very quickly. We absorb the sugar that is in that food. It goes into the blood and causes a big, fast increase in blood glucose. And then usually it's coupled with a big, fast crash in blood glucose. Medium GI foods are, they would be 56 to 69 on our GI index here, our glycemic index. And so those are foods that are broken down and absorbed at a moderate rate. So we're going to get a moderate increase and a moderate decrease. Low GI foods would be at a 55 or less. So those are foods that are broken down more slowly, more gradually, and cause a gradual increase in blood glucose and a gradual decline in blood glucose. So why would we follow a diet that includes low GI foods? So there's lots of reasons. And these are some of the primary reasons. Most people do it because it helps you lose weight. So if we have less of a roller coaster in blood sugar, that means less of a roller coaster in our insulin production. Insulin actually causes weight gain. When we eat foods that cause us to secrete insulin, that insulin, its job is to tell our cells to take up sugar from the blood. And then when we have more sugar than we need, then that insulin also tells us what to do with the excess. It tells us to store it as glycogen, so stored glucose, and it tells us to store it as fat. So the more we're eating foods that are causing secretion of insulin, the more likely it is that we are storing some of that glucose as fat. So if we're eating a low GI diet, that also means that we're going to have better control of our insulin and we're going to have less excess insulin that's causing excess glucose to be stored as fat. It's also used for management of blood sugar and cholesterol, management of diabetes mellitus, which makes sense because that is a condition of high blood glucose. So if we're eating foods that keep our blood glucose low, then it makes sense that that would help in the management of that condition. It also helps to prevent diabetes and heart disease in those who are currently still healthy. All right, thank you so much for watching this video, and I'll see you in the next one.